Namaste. Myself, Dr. Dayananda. I'm a senior cancer Ayurveda consultant and research coordinator in Sriranga Ayurveda Chikitsa Mandira, Mysore. In this Sriranga Ayurveda channel, we would like to discuss more on cancer. While treating a patient or multiple patients with similar stage of cancer, we can see that some people are responding very well, others will take more time. Here, once again, we need to see why. Why not? Because Ayurveda says that though two persons are born in the same time, same place, they are individually different or vary, may be same. So that is what we call it as Prakriti. So Prakriti means how the material is made up of, what is it, how is it. For example, if somebody keeps banana here or apple here, then you say it is banana, this is apple. Why you say that? Because the appearance is that. Or you can say in the other way, if unripened mango is kept, that is unripened, or partially ripened, or completely ripened, because of certain features which we see in them, either physically, chemically, or whenever you touch them, or with your senses, whatever you perceive. So here, each person, individualistic Prakriti, what we say, that is plays a major role. So that means Ayurveda, most of the time, it is considered as not standardized by the perception, whatever we are getting in nowadays. But it is so standardized that we may not be able to reach that standard of individuality where it has to reach the target. So Prakriti is a group of activity which is happening in the body, mainly what we are considering Ayurveda as in Tridosha Siddhanta, Vata, Pitta, Kapha. In that combination, permutation, there will be Prakriti formed. So this is formed during the zygote. It depends on the parents, time of conception, day, season, food habits, their mental status. There are multiple things, including, as we believe in the Punarjanma, the rebirth. So our karmas of the previous birth also include into that. So it's a complicated thing, need not to worry about that. But what we have, that material or a product. So let us analyze the product. If it is Vata Pitta, Vata Kapha are individually dominated, or multiple combinations which you see in that Prakriti as in. So in that we call Kapha as Uttama Prakriti and Vata as an Hina Prakriti. So in Kapha Prakriti people, the stamina, strength is more. Stability is more. Sustainability is more. In Vata, that is opposite to that. So something happens to something stronger or efficient one, they can able to sustain it. But the weaker may not. That means impact of a same force on a heavy object will sustain that, or a brittle or thinner object will destroy. That's the same thing which we can see here. But in Ayurveda, we see disease can manifest either in the manas or in the body. So this can be vice versa, it can happen. So if, as we discussed previously also, the stress levels, if they increases, they will impact the body, which will lead into psychosomatic diseases. Similarly, when you have a physical diseases, if it is not treated for a longer period and you are unable to do the activities which has to be done normally as compared to the normal people by supporting the family, then you start feeling guilty or you inferior or other psychological disturbance will come up. So even the cancer, we can see that it can be from the both sides. If you are ill-treating your body, yes. If you are ill-treating your mind, yes. Both can be the causative factor for the cancer as such. So there is always a question saying that they're undergoing, or the patient or the relative is undergoing the chemo, radiation therapy or immunotherapy, targeted therapies. Can they take the help of the Ayurveda? How Ayurveda can be fitted there, or we can say that whether safer to have it, or whether it is alters the whatever the treatments they are doing. Even I choose to treat cancer accidentally, because I had a patient from France who was undergoing chemotherapy for renal cancer. They didn't reveal that they were taking the chemotherapy there. So when they came here, we felt that pitta imbalances are seen. We need to give the virejana, panchakarma, which is a detoxing thing which is required. Here, whatever you say, pitta as an element included, that means pitta we consider as a transformation. Any transformation changes which is happening chemically, it is because of the pitta. It can be digestion, it can be cellular metabolism, it can be cell division, multiple things to that. So there we give the Virajana, and when he went back, he went for the chemotherapy, and there they found out that he was not required. That means something is happening, because I also had the same fear saying that cancer can be treated, because whenever you say cancer, it comes like a China wall. So beyond that, can we climb? Can we hold? Can we do something? There's no answer for that. After that, I started getting patients, especially the females with breast cancer or uterine cancer, who are treated or operated properly after chemo and radiation therapies, where we could see the secondary complications of the chemo and radiation therapy, either psychological disturbance because of being identified as a cancer patient. And the question comes up always that whenever a cancer is there, the second question is how much time I have. So this fear together creates a huge trauma physically and mentally. These patients we were able to handle successfully, and they were quite happy within a short period, maybe 15 to 20 days of admission treatments, where some of them were the external treatment, some of them were the internal treatments, including panchakarma. So like this, we can help to a patient at different stages after the process or before. Before going to the process also, in Suchata Samhita, that's a surgery text, it is told that even though person is indicated for surgery, try to purify the body so that the body can be identified where or which part to be removed, and the healing process has to be triggered very fast. The same phenomena if you're looking at a modern aspect, where before the surgery, chemo and radiation are advised so that they say that the swelling has to be reduced or concised, where we have the demarcations to operate. Here, we are giving external force to make the boundaries, but through Ayurveda, through Panchakarma, the cells themselves know that what they want to lose. So they are happy to lose something which is not required. Body always try to heal itself by giving up which is not required to it. So here, what I was saying is, when doing Panchakarma, our external therapies or the medications, they try to help the body to sustain the normalcy. Because cancer cells is a group of cells which are present in the body, but the body has a multiple normal cells too. Whenever you stimulate the normal process or whenever you recalibrate them, they're happy to get stimulated and they do their function efficiently. When they start doing their function efficiently, the invasion of the cancer cell will not happen. They protect, they become a shield for themselves. This is how we can prevent spreading of the cancer. So Ayurveda doesn't go with the concept of killing the cancer cells. Ayurveda go with the concept of destroying the environment where the cancer cells will not survive. That is one aspect. The other aspect is strengthen the normal cells which we have so that they become the preventive getting invasion of the cancer cells. So this is how we can help it out. In that, we have been treating multiple cases successfully. We are seeing that quality of life has improved. The positivity in the psychological disturbances you could be able to see resolved. So the people who are undergoing the Panchakarma or Ayurveda treatment during or after or before the chemo and radiation, definitely they are getting results. And we are doing tumor markers tests also so that we also get the documentation, because objectivity is also important for us. Whatever the signs and symptoms, sometimes they mimic that we are getting better result, but that may not be sufficient to prove ourselves that this is worked or not. And we have seen multiple incidents which have helped them. For example, they say that one lung cancer patient with a bone metastasis had 14 SUV intake. So after the treatment, we were able to see that the rest up to 2. That means the whole activity has been reduced or shut down. That means the cells has taken their chance to fight against whatever was happening there, and they could prevent. So if this can happen, then why can't we combine the therapies or go alone, which is up to the decision of the patients once again? We could help definitely with the cancer patients to treat with Ayurveda methods or the tools and techniques which were time tested and accepted from generations and which will be offered with the same best quality in Sriranga Ayurveda Chikitsa Mandira. And we are here to help whoever is required. Please contact us.